just like start from where I am now.
Good.
It's on. Okay. So I got a call that interrupted the video, but okay, I'm still at the same spot where I was about to open. This is the ABB pad. And all of this can be opened onto this field because it's sterile. And there's going to be 4 pieces of gauze, and 2 of them are dry gauze that are going to be laid over the wound, and there's going to be 2 pieces of gauze that are going to be wet with saline that I'm going to use to pack the wound. Still want to try to avoid reaching over the field as much as possible. And I'm going to then take out these Q-tips, well, cotton-tipped applicators. They look kind of like the Q-tips, and this is going to be used to help get the gauze inside the wound that's used for packing. So this is the sterile saline solution, and the outside of the bottle is not sterile, but inside the bottle is. So I'm using it before I'm going to put on my sterile gloves, and I'm going to pour from the side with the label away from me, and just pour it onto the gauze. Okay. And now I am going to put on my sterile gloves. You might want to come up so you can see me. Did I know how to do it? Okay. So open this away from you. And once again, I can touch the outside of this and the 1-inch margins. So the inside of the gloves are not sterile, so I'm going to pick up the first glove by the cuff because it'll be touching my skin, so it will not be sterile. And I'm going to put my hand in it. That was right. And I can adjust more later when I have the other set of sterile gloves on. I think, okay, wait, this is the thumb. Over here, just kidding. I still did not break the sterile field, so it's okay. Okay. So I'm going to wait to fix this until I get the second glove on. And I'm going to pick it up using the cuff right here by slipping my fingers under that cuff. I'm just sliding the glove on. Oops. Okay, now I can touch like this because the outside of the gloves are sterile, so it automatically object is still sterile if it's touching another sterile object. I know these gloves are a little trickier than usual, but I've not broken the sterile field yet, so that is good. Hopefully it won't take this long. Put on the gloves. In the clinical setting, okay. So here are the two pieces of gauze that I wet with the saline, and I am going to kind of roll them out, and then I'm going to squeeze out any excess. Oh, and before I start to pack the wound, I need to cleanse the wound, and I'm going to go from most sterile to least sterile, and usually so moving from top to bottom, because the top is most sterile and least sterile is going to be at the bottom, and then I'll start to pack it. And I'm going to use this to help the packing. So here. Separate these, and again just trying to work from top to bottom. Okay, and then I'm going to open the ABD pad. This side of the pad with the blue stripe is the side that goes up, so you're gonna pinch the sides of it to place it down over this. And now my gloves are no longer sterile, but that's okay because I am done with cleansing and redoing the dressing change. I probably should have positioned the table a little closer so I had less reaching over, but it is okay. Tricky because this pad, this little place up is actually broken, but you know, clinical setting, you would not be using a broken bandage covering. Alright, so I'm going to cover back the patient back up. And I'm going to go ahead and discard of my supplies. Alright, Mr. Smith, are you still feeling okay? Just lower the bed back down. Alright. Well, if you need anything, your call light is right there. And me or one of the other nurses can come help you out. All right, and then I would go out and use hand hygiene again.